So welcome to the Allergy, Airway, and Sinus Congestion webinar tonight. My name is Heather Schofield. I'm a homeopathic doctor and also medical educational director and acting medical advisor for Biomed and Terra Medica. I'm thrilled tonight to be talking about allergies from a biological medicine perspective. So let's just dive right into the subject. So what are allergies? And for most of you listening tonight, this is something that you're all very well versed in and are very aware of, but I do want to review some of the basics just so that we all start on the same page. So allergies are an overreaction of the immune system to harmless substances. The body or the immune system is having this hyperreaction, acting as if it was under threat from something that could be a harmful substance, but instead, in most cases, it's a very harmless substance. Types of allergies, depending on the type of allergy, will also depend on where you'll see different reactions. So you can have skin contact, like poisonous plants, latex, animal dander, or jewelry. Ingestion, so milk, medication, including nut and shellfish. You can have injections, like in medications, or bee stings. And finally, the inhalation allergens, which include things like pollen, dust, mold and mildew, and animal dander. It's going to be this aspect that we're going to be focusing on tonight, the inhalation allergens and how they affect the body. Allergies is a huge topic, and we could be talking about a whole gamut of different things. Food allergies are also a very predominant aspect, but that won't be what we're focusing on tonight. More, it will be the inhalation allergies. So an allergic reaction overview, just so we refresh again what is actually happening within the body. So first, we have an allergen that enters the body. Let's say that it is some pollen from a tree. The allergen has an initial contact with a B cell in the body. The B cell then changes to a plasma cell and releases IgE antibodies. These IgE antibodies then bind onto mast cells, and the mast cells are filled with granules that include histamine and another chemical on the cell wall, which is a leukotriene. When there's a subsequent contact with the allergen, then the granules get released from the mast cell. The mast cell releases these granules, which is histamine and other types of chemicals, and then we see an allergic reaction. So there is this release in histamine causes a reaction, some of those typical things, itching, watery eyes, runny nose, but then the reactions can be definitely more severe than that. So allergic reactions and symptoms, these are some of the common things you may see. And this is, again, as I mentioned, we're going to be focusing on more the airway aspect and the inhalation allergens. So this doesn't really include the food allergens. So types of things you may see can be mild to severe and even life-threatening, and the life-threatening type reactions are these anaphylaxis type reactions. So when an allergen is inhaled, then types of reaction that can happen: swollen sinus linings, eye inflammation and tearing, runny or stuffy nose, itchy or sore throat, and also blocked eustachian tubes, so ear congestion, potentially ear infections. The sinuses, the fluids can get trapped in the sinuses, causing sinus infections, and then finally into the bronchioles and into the lungs, and asthmatic attacks can also occur. So the connections from the airways and asthma and allergies is that in the bronchial tubes, if there's an inhaled allergen, so again, let's say a pollen, then the natural killer T cells release cytokines in response to these allergens, and it triggers inflammation. This inflammation or the airway passages then become inflamed and mucus-filled, and then this is what's causing that asthma attack and difficult breathing within the airways. The other connection I want to just make is with the sinuses. So again, with an inhalation of an allergen, again, let's use pollen, what can happen is you get a major inflammatory reaction within the sinuses, then that creates mucus. If things are not able to drain properly, then the mucus can turn into purulent discharge, And you may also see the eyes and watering eyes, a drippy or runny nose, and also postnasal drip. So with fall allergies. Now, allergies, of course, they're always a hot topic in the spring because this is when all the flowers and the trees are blooming and releasing lots of pollen. But fall allergies are still nothing to forget about. So 25% of Canadians are affected by hay fever or pollen allergies and respiratory symptoms during the autumn months. So while this may not be the same number that would be affected in the spring, it's still a significant number of people. The typical fall allergens include pollen and ragweed very specifically. Ragweed is very common in the middle provinces and also Ontario, or the more eastern provinces. Ragweed definitely likes hotter, drier type climates. Mold and dust mites are also two of these inhalant allergens. And why they become a problem in the fall is because mold, as we come indoors, we're starting to breathe this, and same with the dust mites. And then finally, pet dander and pet fur. Now of course, they could be an allergen at any point of the year. So ragweed then, or hay fever. So if you're in Vancouver or based in BC, you may not be so familiar with this type of hay fever, but if you're in Ontario, then you would definitely be very familiar with this. So ragweed, this plant, it's the biggest allergy trigger in the fall. The pollen starts to get released when the nights cool down, but the days are still warm in August, and this pollen release can last into September and October. So essentially, this is one of the biggest culprits with fall allergies. About 3/4 of the people that are allergic to spring pollens are also allergic to ragweed. If you've ever seen fields of ragweed or ragweed growing by the side of the road, it is quite a beautiful plant, and it's unfortunate that its pollen creates such havoc for people who have allergic reactions to it. Here's some interesting information. It's always good to have a bit of interesting information in a webinar. Top Canadian cities for allergies. So they're not necessarily ranked, but they're top allergy cities, or cities for allergies. So Edmonton, and its big claim to allergies is a large amount of outdoor mold, and it happens to be due to the environment. So typical types, symptoms: sneezing, wheezing, lots of itchiness, runny nose, dry skin. Toronto, ragweed. Asthma, wheezing, chronic cough, runny nose, shortness of breath, and itchy eyes. Vancouver is very affected by tree pollen, specifically birch and alder. And these types of tree pollens can create very severe allergic reactions and asthma attacks. Of course, this is a little bit more predominant in the springtime, not so much in the fall. My nephew, he had a very severe reaction this spring to these two pollens, and it was very hard to watch such a young child go through such severe allergic reactions. In Windsor, it's not so much about allergens, but there's a huge amount of pollution and diesel exhaust because it contains one of the most highly used transport bridges that exist between Canada and the United States. And so there's a huge amount of pollution and diesel that comes from that area. And so there are links with increased pollution, especially living close to major highways and with this diesel exhaust, to increase environmental allergies and also asthma symptoms. Halifax is full of dust mites, and it happens because it's a damp, because it's near the ocean. Sneezing, runny nose, and asthma. And then finally, Yellowknife. It also has a huge birch tree population, so tree pollen is another one, and so same types of symptoms as Vancouver with these hay fever, allergic reaction, and asthma symptoms. So let's talk about success in addressing allergies. So with addressing allergies, one of the first things is to really understand what is happening within the body so that we're able to really get to that root cause. So blocking histamine or avoiding substances are common practice, and they're a common practice in both working in conventional and more alternative medicines. However, doing these two types of things is not really addressing the root cause. If you're going to block histamine, you may have it so that the symptoms are not prevalent, but that doesn't mean that the allergies have gone away. And also avoiding substances or these pollens or these allergens may be possible. They may also not be possible. If you're allergic to a cat or cat fur, cat dander, then it's easy to avoid that if you don't go to people's homes with cats. However, avoiding things, again, is potentially limiting life and not really, again, getting to that root cause. So things that really need to be considered. Number one, recognizing that the allergen is a triggering factor to an overreaction of the immune system. And then more importantly, these allergies or this overreaction of the immune system is an indication of a severely disturbed internal milieu and compromised intestinal mucous membranes. And so this work and this thought process all comes from biological medicine principles. Tonight what we're going to talk about is more from the internal milieu and the mucous membrane and the gut perspective rather than the allergen perspective. Okay, so addressing allergies then. So success for long-term allergy relief should include symptomatic relief. Now, symptomatic relief is important for patients because if they are suffering from allergies, then we don't want to say, well, we're going to work on your milieu and we're going to work on your gut, but you still need to suffer through these symptoms. So the symptomatic relief is really good to keep patients on track, to keep them compliant, and also to give them ease so they can get along with their day-to-day life. And it also gives us time to be working at the deeper underlying cause of what's going on. So with the milieu therapy, things like diet, acid-base balance to help reduce the milieu hyperacidity, supporting digestive functions, addressing intestinal mucosa, and promoting healthy symbiotic microorganisms are different aspects that we'll talk about tonight. So therapy options then. These are just a kind of a general range of therapy options that exist out there, whether it's conventional or more in the alternative realm. So includes antihistamines. These can be prescriptions, they can be over-the-counter antihistamines like Benadryl, for example, or they can be herbal. And that's the one thing to remember, that there are a lot of natural formulas out there, including different herbal formulas that do have an antihistamine effect. There are allergy shots, and I've heard lots of people have good success over time, but it is something that is very time-consuming. The patient has to visit the doctor on a regular, I believe it's a weekly basis, to get these allergy shots to eventually desensitize their bodies. Patients can work with neti pots, and so the neti pot is used to flush a saline solution, so you add some specific salt to water, warm water, and then to pour that through one nostril to kind of flush through the sinuses and then pour out the other nostril. And so it's used to flush the nasal passages. And what that helps to do is it washes out allergens and other toxins or anything that's within there to help relieve some of the inflammation going on. And then in addition, it can be used to thin the mucus out as well. Patients, especially patients who have a lot of allergies or asthma, using a HEPA filter at home will help clear the air. And for some people, the being indoors with the air conditioning on can also be very helpful. Avoidance. So this is one thing I already mentioned. In some cases, it's okay, and in other cases, it's hard. So imagine you have a patient who's trying to avoid pollen in the spring. So then does that mean they sit inside their house all the time with a HEPA filter and the AC on, or walk out of their house with a gas mask on? Those are not viable options for a very vibrant life. So avoidance, while definitely in some instances for sure works, it's better to get to the root cause so that they don't have to avoid those allergies in the future. And then finally, Dr. Mercola, he talks about using a provocation neutralization allergy test and finds that it's 80 to 90% effective in patients, and it's something they can do at home. And it's about injecting allergens under the skin, creating a wheel, watching the reaction, and then neutralizing with under the tongue watered down or diluted allergens. So, okay, and then what we're going to be focusing on now is some other therapy options that are addressing from a more biological medicine perspective. So I'm going to be talking about diet, the restoration, regeneration type diet, also acid-base balance, drainage and detoxification, probiotics, and gut support, and why gut support is really quite important when addressing allergies. So Dr. Rao, regulation. We treat humans, not symptoms or diagnosis. We support the regulatory forces in the human, which brings healing from the inside. And so this is really about what I'm talking about is this regulation so that the body can self-regulate in a very healthy and balanced way and not have the immune system overreacting to these non-harmful substances. But how do we get to regulation? That is a question, and that will be answered. Okay, so Hippocrates, in his wisdom, all disease begins in the gut. So, of course, a big component of what we'll talk about is the gut. And let's start doing that right now. So, the question, who needs to restore gut health? Healing the gut is important for people who suffer a whole variety of types of conditions, including chronic degenerative conditions. This is a list kind of for, the whole group, but specifically people with allergies, people with asthma, people with inflammatory processes of any kind, people with chronic sinusitis, and people with postnasal drip are all really good candidates to restore the gut. In my personal experience and working in the biological medicine perspective, if you don't heal the gut, then a lot of these symptoms you're never going to be able to get a good handle on or help your patients get a good handle on. So going back to the gut is a really important key component to this whole process. So who needs to restore gut health? Starting from birth and as life progresses, there can be many gut damaging factors. And these types of things include the type of delivery at birth, a vaginal birth versus a C-section birth. A vaginal birth is inoculated with a lot of different microorganisms. However, a C-section birth generally is not. Breastfed and the types of foods that are eaten in the first years. Dysbiosis, so candida and yeast overgrowth. Chronic infections, over-acidity of the body, food allergies, chronic stress, heavy metals and toxins, poor diet, and eating the wrong foods. And then also various medical interventions and medications, including antibiotics. These are all types of things that can throw gut health off. So let's just review the gut quickly. The constituents of the gut, so I'm going to talk about the mucous membranes, the Peyer's patches, and the bacterial lining. So why is the mucous membrane so important? It represents a protective barrier from foreign substances entering the body. And if you've got a good, healthy gut, then from a food allergy perspective, if somebody's eating something that potentially could cause an allergic reaction, when there's a healthy mucous membrane, it's going to not necessarily allow that process to happen. So keeping the body in a much healthier, balanced way. Of course, the mucous membrane is important for absorption of nutrients. It helps to detoxify the body. It's involved in acid-base balance. It's a major defense system in the body, and it secretes immune substances for mucosal immunity. Next, we've got the Peyer's patches, and so they're found within the Kreckring folds in the intestinal milieu. It produces T and B cells, and 80% of the adult immune system resides in the small intestine. So it plays a huge factor in immunity within the body. If the Peyer's patches are overburdened, then there's a decreased performance. And then what you'll actually notice is that the human body responds by making more lymph nodes. And so this is a really interesting point. And this is seen in children. And I've heard Dr. Rao talk about this quite a bit. What happens is if the gut or the intestinal tract is overburdened, and in a lot of cases this is with food or potential allergens from food, then there's going to be this decreased performance. And so the body is trying to make up for more immune cells to compensate for the lack of within the gut. And so you find that the lymph nodes increase. And this often leads to increased or enlarged adenoids and increased tonsillar swellings. So when people have increased tonsillar swellings or increased prone to infections and even potentially are candidates to have their tonsils removed, really it's not so much about the tonsils, it's really, again, going back to the gut and what's happened within the gut. And so back to healing the gut, because in the end, that's really where the root of the issue is stemming. Okay, so then I want to just talk here, why are the bacteria flora so important? So they, of course, nourish and protect the intestinal mucous membranes. They offer resistance to growth of bad bacteria and fungus, specifically systemic yeast or candida is one of them. Digestion of food. They help to produce enzymes. They aid nutrient transportation through the gut wall. They help detoxify the body, soak up toxins, example, arsenic. They help to deacidify the body. And they manufacture all kinds of different vitamins, including a lot of the B vitamins, folic acid, vitamin K, essential fatty acids, and various amino acids. And just talking specifically from an allergic perspective, a decrease in intestinal flora is correlated to chronic illness and allergies. So here is a study with the role of intestinal flora in the development of allergies, and this is available in the current opinion in allergy clinical immunology, this study. And so what they found was they looked at children with allergies, specifically atopic eczeema, allergic rhinoconjunctivitis, and asthma. And what they found in these children was that there was this delay in the development or the compositional development of bifidobacterium and lactobacillus in the gut microflora. So they were finding that there was reduced amounts or they weren't developed properly, and there was a direct link with children with increased amount of allergies. So what this showed is specific strains of healthy gut microbiota produce this IL-10 and transforming growth factor, and this is important for a regulatory role in development of allergic type immune responses. Probiotics, in addition, help to strengthen gut defense barrier mechanisms and reduce the antigenic load in the gut. So there's a lot of information within the study, but essentially what it is that there's a very big link to poor, low, not well-developed microflora and increased amount of allergies in the body. So that's why probiotics are so important. So before we start talking about probiotics and some other things, let's talk about diet and eating for restoration and regeneration. And so this isn't really about a diet or a fad. Instead, it's a purposeful way of eating for long-term health. If you've listened to some of our past webinars, and if you haven't actually listened to them live, they're always archived on our website. There is a whole webinar that's dedicated to the restoration and regeneration diet. So if you want more information about that, feel free to listen to that webinar. So the whole purpose of restoration regeneration diet is to remove all potential allergens and acidifying foods from what we eat on a daily basis, which will then help a rapid healing of the intestinal system, the mucous lining, bacterial flora, and the Peyer's patches. So we're supporting the gut, we're supporting the flora, and we're supporting the immune system through eating in a very purposeful way. These types of things, so this restoration, regeneration, regulation, these are all things that come along with that. So one of the things is we're restoring the gut flora, the mucous membrane lining, and we're boosting the immune system. In addition to diet, things like probiotics, fermented foods, essential fatty acids in the form of oils are all aspects that can also help with this. The regeneration part is by removing the food allergens, we're able to regenerate the cells in weak, diseased organs. And so, again, going back to diet is about removing potential allergens. And then finally, regulation is allowing the body to detoxify, deacidify, or have a proper acid-base balance and enhance hormonal and cellular metabolism. And this is done through alkalizers, which we'll talk about in a little bit, digestive enzymes, and then the alkaline components of a diet. Here's an interesting fact, the cellular lifespan. You may have heard that within a 7-year time period, our body is a completely new and fresh body. And so from moments and hours and minutes to 7 years, everything is regenerating and renewing within the body. Everything, organs and cells and tissues, it's constantly regenerating and renewing. And so some of our therapies that we're working at, this is one thing to keep in mind. Often when we talk about the regeneration and restoration diet, we talk about it from a 3-month perspective. And same with the detoxification. So if you're working with drainage remedies, some of these things are based on how long it takes for these organs to regenerate. And so for the intestinal bacteria, it takes about 3 weeks. And so when taking a probiotic supplement, then think about it in that term, that you want to do it for a minimum of 3 weeks. Intestinal mucous membranes, summer takes between 2 to 4 weeks. Skin, 2 to 12 months, and then, as you can see, the list goes on and on. And so in a lot of ways, if we have patients who are committed, and ourselves as practitioners committed to eating in a very particular or specific way or purposeful way, then we can support all of these things happening within the body and really, truly kind of recreate our health within our body. So eating for restoration and regeneration, there's a few more points I just want to talk about here. So the basics, it's helping to build up the intestinal flora. It does eliminate or recommend eliminate cow dairy, gluten, and other food sensitivities, reduces the amount of protein that we're eating so that we're eating the right amount of protein that our body can process on a daily basis, increases vegetables. It helps support the liver function, bile flow in the bowels, and it's also acid-base balance to support the milieu. Now, Dr. Wertman, he talks about primary and secondary antigens. And so the primary antigens are foods that are introduced in the first 9 months of an infant's life. Often includes cow's milk, hens, eggs, and wheat or gluten. And these are things that have been introduced to infants over decades and over centuries. And so when he says primary antigen, what he's saying essentially is over our generations, our body has often started to create reactions to this. Now, I know I said we weren't going to talk about food allergens tonight, but this still is very relevant when we're talking about allergic reactions and asthmas and sinus congestion, because in the first 9 months of life, if your gut is, for better term, destroyed, then you are going to have allergic reactions. Then there's these secondary antigens, and these develop as the intestinal villi kind of atrophy, and then all these other sensitivities or allergies come into play as well. So one of the biggest things, if you think about it, and I will be the first to admit I'm very pro breastfeeding for infants, exclusively for the first 6 months of their life, and then up to a year, but then also beyond that. So up to a year while they're still trying out foods, and then for sure to 2 years, and even the World Health Organization and Health Canada and the American Pediatric Associations are recommending even beyond 2 years. And if that's feasible in your family or patients' families, then it's one of the things you can definitely give your child as far as very good health. So with the cow's milk component then, if parents are using formulas, there's not very many options out there. There's cow milk formulas and there's soy-based formulas. And so with the cow's milk then, it's best to do whatever you can for a child to avoid cow's milk until they're at least a year and their gut has had an opportunity to do some development. Okay. So here's a photo of the mucous membranes in the gut. So healthy mucous membranes of the intestinal tract, you will see there are the villi and the microvilli, so a large amount of surface area, but the atrophic mucous membranes will occur after exposure to these primary antigens. So it will become this flat, like moon surface. And then you also get spaces, and the spaces could be equated to leaky gut, and as foreign particles are getting into the bloodstream, then it's causing all kinds of allergic reactions in the body. And so Dr. Wertman also talks about this, or he calls these hidden indications of intestinal allergies. And this is the other thing that's also interesting, is that our mucous membranes in our body are intrinsically connected. So you may have a sensitivity, intestinal allergy, but not necessarily realize, because symptoms may not be appearing within the gut, but instead a chronic sinusitis, for example, may occur. And so this list here is indicating all the different types of conditions that are really related back to the gut. And again, this is why it's so important to support and heal the gut. So from a inhalation allergy perspective, then respiratory conditions, and so in infants you can see different sniffling or runny nose, bronchitis, asthma, hay fever, allergies, sinusitis, sneezing, chronic cough. And then also skin conditions, cradle cap, neurodermatitis, different types of dermatitis, eczema, seborrhea, vitiligo, acne. I once had, well, I was very fortunate to spend a week with Dr. Wortman in Toronto years ago, and he brought it to my attention with these sneezing attacks. And there was times where I would eat things, and I have a milk sensitivity, and so I didn't really realize it to the extent, and maybe I didn't want to admit it to the extent either at that time. But after certain things I'd eat, I'd start sneezing, and I'd have many, many sneezes, and then my nose would end up running. And once I blew it, then everything was fine again. And so the first time it happened, he looked at me and he said, hidden intestinal allergy. And at first I'm thinking, oh, that's just crazy. I've just inhaled a little bit of dust. But, you know, as I started tracking it, I really did see that there was a big connection to it. So he's a very wise man, that Dr. Wortman. Okay, so just a few more things with the diet here. So the diet in general, it's low in protein, somewhere between 40 and 60 grams a day. And this is about the amount that can be processed in the body on the cellular level. Anything more than about 60 grams a day will create excess acidity in the body. And so I know living in the North American society, it's very, in many circles, pro-meat and very heavy meat and large amounts of meat. And so once you get past 60 grams, your body's not really producing it, and you're just creating a lot of acidity in the body. So it's changing the mindsets with our patients. The restorative and regeneration diet is alkaline in nature. It's free from food allergens, particularly cow dairy, so this helps to reduce congestion, inflammation, impairment of the immune system. Cow dairy can also disrupt regulation, and we've talked about the villi and the microvilli as well. And then finally, this diet is also high in omega-3 essential fatty acids, so to help enhance cell metabolism, cellular membranes, transmission of neural signals, oxygenation of the tissues, healthy flora, also will support this as well. Okay. Oh, and let me just go back to this chart. Dr. Nysgaard made a comment. Thank you for your lovely comment, Dr. Nysgaard, about this being a lovely chart to explain the connection between the gut and other symptoms. This chart is also available. There's two books that we have available through Biomed. They're both by Dr. Wortman, and this chart specifically is out of the successful treatments for allergies and chronic illnesses. So there's more information in these books. What I can do is I'll do a follow-up email, and I'll make sure I include the title of that book, so if you want to have more information, then you can get it there. Okay, so with the restorative and regenerative diet, foods to avoid, meat, specifically beef and pork. It's red meat more than white meat. Dairy, specifically cow. In many cases, goat may be okay. Eggs, again, specifically chicken, shellfish, predatory fish, tuna, for example, because of the high heavy metals, nuts, citrus fruits, commercial fruit juice, histamine-rich foods for patients that are dealing with allergies. Histamine-rich foods may set off more reaction within the body. Refined sugars, processed foods, preservatives, soda, yeast-containing foods, and white flour products. Okay, so what to eat then? Vegetables, all veggies, leafy greens, avocado, seeds, nuts if the patient's not allergic, oils including olive, sunflower, flax, grapeseed, and coconut, rice, beans, legumes, soy, organic soy, not too much, but some organic soy for some patients can be okay, and seaweed, whole grains, goat and sheep dairy in most cases for most patients is okay, fresh squeezed juices, whether it's fruit or vegetable juices, turkey, small fish, and chicken, but not necessarily every day. It's more of a plant-based recommended diet, at least for a 3-month time period. Lemon juice and some mild vinegars like apple cider vinegar in most cases are okay. Fresh spring water and salt, herbs, and spices. Okay, and then last, the importance of this diet and why we're talking about it from an allergy perspective. Approximately 6 weeks to 3 months, because this is, again, following that natural regeneration cycle of the body cells. Excludes the primary antigens so that there's a chance to rebuild the mucous membranes in the small intestines, restore the immune system, so you get a reduction in the IgA, And then finally, naturally detoxifies and deacidifies the body. And for the diet specifically, there's this book by Dr. Rao, The Swiss Secret to Optimal Health. It is available through Biomed, and this book outlines this diet. This book is written so that patients can follow it as well. So it's great for practitioners, also great for patients. If you have a lending library with patients, then this might be a good book to have on the shelf. And it outlines all of the reasons why they want to follow this diet, plus then there's a diet plan, whether you follow the intensive, which is a 10-day, or the maintenance, which is a 3-week, and there's lots of recipes in it. So it's definitely an interesting thing to do, and this is what they follow at the Paracelsus Clinic in Switzerland with their patients to get their gut restored and get the body more alkaline and just support the regulation within the body. Okay, so now I'm going to talk about alkalizing. I'm not going to go into huge amounts of detail because it can take quite a bit of time, but the other thing is there also is a webinar called The Art of Alkalizing. So if this is a new topic for you and you want to learn more, then please feel free when you have time to listen to the Art of Alkalizing webinar. It really, from a biological medicine perspective, is really one of the base foundational therapies that could be done almost all patients to really get the acid-base balance balanced within the body. It's very foundational. In many cases, it's very inexpensive, and so for some patients, if they only had very limited amounts of money, but they needed to do the best bang for their buck, having them alkalize will really, really support their body in such a great way. So back to acidic and alkaline forming foods. We talked about this a little bit already. So things like alcohol, coffee, tea, meat, dairy, sugar, flour, those are all acid-forming foods. And then the alkaline-forming foods are fruits, vegetables, and lemon juice. Some of the grains are slightly alkaline or slightly acidic, and so it's important to have patients thinking about these and have more proportions of fruits and vegetables in their diet and less heavy meat and dairy and flour, white sugar, and coffee and tea. It doesn't mean no coffee and tea, it just means not 5 cups a day. Okay, so how does alkalizing work? So essentially when we're alkalizing, we're looking at the pH, or the hydrogen ions concentrated in the tissues. So an acidic terrain is prone to inflammation and allergic reactions. And so that's why we're talking about alkalizing, because prone to inflammation and allergic reactions. It sets the patient up potentially for more chronic conditions down the road, and it's not supporting if the body becomes too acidic or the tissues become too acidic or too alkaline, depending on the tissue and what its specific pH range is. The microorganisms also then have to start adapting to this newer pH change and therefore can become pathogenic or out of balance and not functioning in their symbiotic way. This is one of the big things that happens with Candida, actually. When we have Candida overgrowth, it's that it's an adapt to a new environment that turns the Candida on to start degenerating the body. Okay, so the goal with alkalizing is to flush out the excess hydrogen ions and to get a normal acid-base balance. It's using natural buffering minerals like calcium, magnesium, sodium, and potassium, and the key component is this bicarbonate. So sodium bicarbonate and potassium bicarbonate. The bicarbonate is the key with an alkalizer because it ends up going into the sodium potassium pumps on the cells, end up getting the bicarbonate into the cells, and then the bicarbonate becomes raw material for formation of enzymes in the pancreas, bile in the liver, hydrochloric acid in the stomach. So not only are we using up all these excess hydrogen ions in the body, but we're also supporting better digestive function as well. So to measure the pH in the body, ideally, to do all three, blood, saliva, and urine, and that will give you a complete picture, and it can be done through biological terrain analysis. If you don't have access to that, then the next best option is to be looking at the urine, and then the third best option would be saliva. So with the urine then, a urinary pH will indicate pH levels of the tissue and tissues in the body and how well the body is excreting this excess acid or these hydrogen ions from the body. The saliva tends to give you a different picture. It's more about functioning of your adrenal glands and also of the digestive processes as well. So for pH measurement, there's 2 times you want to do it. So number 1, first morning urine. If the pH is 6.5 or less, so 5.0 or 5.5, then this is indicating tissue acidosis. Always the first morning urine is going to be more acidic. However, its general range is somewhere between 6.5 and 6.8, or maybe 6.2 to 6.8. So for the rest of the day, the range should be 6.8 to 7.4. So if you're measuring then at spots for the rest of the day, if it's below 6.8, again, this is a confirmation of tissue acidosis in the body. So the other thing with taking an alkalizer, it's very important to take with warm water. This keeps the pyloric sphincter open so that the alkalizer bypasses through the stomach into the duodenum, and then also on an empty stomach. You don't want to neutralize the stomach acids during digestion. The other thing that can happen is it will cause burping, and many patients become uncomfortable and then don't take it any longer. It takes somewhere between 1 to 3 months to mechanically shift the acid out of the body, and using the pH to measure this will help you determine how long a patient needs to alkalize for. The general, though, is about 3 months. Okay, so the alkalizers then that we have available are Alcala, basic powder, basic tab, and Alcatab. And so I just want to review these quickly. Oh, the other thing is pH papers. We do have pH papers available. They do come in the boxes of Alcala, and then we also sell them separately. So with the pH indicator, this is the range that we have in there, and it's a book of 48 litmus papers that is great for patients to do their pH at home or for you to do it within the office. So Alcala, it's a powder, sodium citrate, potassium bicarbonate, and sodium bicarbonate. And it's taken twice a day. The one thing is it is a little bit on the salty side, so sometimes there's a bit of a compliance issue with patients with that. But it is a strong alkalizer, and it is very effective as well. We also have basic powder, and so it's in a powder form, and it serves the same function, but its composition is a little bit different. It's sodium bicarbonate, potassium bicarbonate, magnesium carbonate, and calcium carbonate. So it's a milder alkalizer. In some cases, though, it's better tolerated than the Alcala, and it may take a little bit longer to alkalize the body than perhaps Alcala, but the saltiness is not as strong within it. And then we also have my favorite, basic tab. And the basic tabs, again, it's a similar composition to the basic powder. However, it's in a tablet form. And so the reason I like basic tabs is because it's very easy to take. Basic tabs, they dissolve within a minute in the stomach, so there's not a lot of concern regarding using basic tabs and basic powder as far as getting it into the system. And it's also easy to travel with. It's easy to take, and there's no powdery water that you have to drink. However, any of the combination, Alcala, basic powder, or basic tab, they're all very effective alkalizers in their own right. Okay, and then I also just want to mention Alcatab. So Alcatab's a little bit different. It's just sodium bicarbonate, and it's pharmaceutical grade, so there's no additives or preservatives or contamination within it. It's generally used specifically for inflammatory response or allergic reaction, specifically of the airways, but it also could be of the gut or mucous membranes as well. And so this one is used usually within the first 10 days of a reaction, and it's used to help calm the reaction down while you start working at the underlying cause of what's going on. Okay, so other recommendations then from an allergy perspective, and again, as I mentioned, mostly we're focusing on the inhalant allergies, and so Allernest. It is definitely our #1 allergy formula. It's from Nestman Pharma, and it works beautifully for all kinds of allergies. It works for seasonal allergies, it works for environmental allergies, and it also works for food allergies. So this is kind of an all-over allergy formula. For inhalant allergies, however, it's very effective. It generally works in about 20 minutes, and so patients can use these very much like an antihistamine while you're working at the deeper underlying cause of what's going on in the body. So how it supports the body, it has antihistamine-like effects. It decreases the hyperallergic response within the body, reduces inflammation of the mucous membranes, and it strengthens the cell walls. Again, used in cases of allergies, including seasonal, environmental, and food allergies, including hay fever, coughing, sneezing, difficulty breathing, hay fever, I said that twice, rashes, itching of the skin, food reactions, and headaches. Dosing. So acute dosing would be 10 drops in water every 15 minutes. And then if you're going to go with a more general dose, then 10 drops in water 3 times a day to just kind of have our patient work through allergy season and get them through the day. And as I mentioned before, it works within about 20 minutes. So it's a really great symptomatic relief formula, but it also is helping to work out the underlying cause as well within the body. So now I want to just talk about BioBoost. And BioBoost, it's a little bit different. It's more for immune support. And so while it's not specific for allergies, it is really great at boosting the immune system of the body and the body's natural defenses against viral bacterial infections. It works on the nonspecific immune system by stimulating granulopoiesis and increases phagocytic function of the leukocytes. It's used in colds and influenza, fevers, lymphatic inflammations, respiratory tract infections, feelings of weakness or exhaustion, inflammations, any types of secretions, and purulent discharge. So if patients are getting secondary infections with their inhalant allergy symptoms, then this would be one that you could work to boost the patient's immune system. In addition, we are starting to approach cold and flu season. Now we're kind of in the beginnings to mid-September, and so these are things we need to start thinking about for our patients in the upcoming months. So BioBoost is definitely a good one for that. Acutely, so this is if you feel a cold or flu is coming on, or you're being coughed on by your patients or your neighbors or your family, then you can take it acutely, 40 drops in water every 4 hours until signs of improvement, or generally prophylactically 20 drops in water 3 times a day. This is one that I travel with all the time. I always have a bottle of BioBoost in my possession. So Bronca then, this is for lung and bronchial support. And so from inhalant allergy perspective, if patients are having upper respiratory type reactions, so bronchial spasms or lung type of things, then this is going to be the formula you want to consider to help support them through that. It's also a drainage, so great for draining the lungs and the bronchioles as well. And it's very good for coughs, and it helps with asthma. It's got some peppermint in it, and peppermint is a bronchial dilator, so it helps. While it's not going to be a substitute for an asthma inhaler, it's definitely going to help open things up. So it increases lung function by relieving cramps in the bronchial tree, loosening mucus, and increasing expectoration, improves oxygen uptake. It's an anti-inflammatory or an anti-tussive, which is helping to relieve coughs. So lung, bronchial, asthma, coughs, bronchitis, these are all things to consider with Bronca. Dosing is 30 to 40 drops in water 3 to 5 times a day. And then now we've got 2 sinus products that I want to mention. So Hydrastis nasal drops. This is specific for sinusitis and allergies, or chronic rhinitis, which is a runny nose due to allergies. And so this Hydrastis nasal drops can be sprayed directly up the nostrils and into the sinus cavities. It works by stimulating excretion and the function of the mucous membrane, so it gets things flushing and moving. It helps to decrease inflammation, and it helps prevent drying out of the nasal mucosa, which also helps normalize nasal breathing. So it's really working at protecting and bringing down inflammation in the nasal mucosa and the sinus cavities. The other thing that it's really helpful for is for flying, and the dry air on the airplanes can sometimes drive the nasal mucosa out, which then leaves the body more prone to pick up infection, and so this is one of the ways that you can help prevent that. Dosing 1 to 2 drops in each nostril several times a day. The one thing to remember about this is if there's a lot of inflammation happening in the nasal mucosa and the sinus cavities, this product sometimes can burn for a moment when patients initially use it. So it's generally, once it stops burning, you know that the inflammation is down, but just one thing to keep in mind that there can be some burning that happens with this product. And then finally, loofah tabs for sinusitis. Sinusitis and associated symptoms for sinus infections. It's a well-known German formula. And I'm just going to go back. I just noticed I had some questions pop up here. So Jan, 1 to 2 sprays. Yes, so it's basically, sorry, we used to actually have it as a dropper. So yes, 1 to 2 sprays. So 1 spray into each nostril is what is done. 2 sprays if it's a really bad infection. Okay, so back to loofah tabs. So loofah tabs, it's a traditional German formula, and it is slightly homeopathic. They're tablets that dissolve under the tongue, and what it helps do, or its mode of action, decreases inflammation, decreases lymph nodes and tonsils, stabilizes the function of the sinubronchial complex, and helps stimulate secretion of the mucus and facilitates expectoration. So 1 tablet under the tongue 3 times a day. This is an easy formula definitely to take and is very helpful with sinusitis. Okay, and so I've got 1 more allergy formula here, and then there's just a few more products from the gut and a protocol that I want to go through. So before we get there, then allergies. The last one is Allergies. So Allernest is by far, from the Biomed line or the Nestman line within the Biomed line, Allernest is the #1 allergy formula. Allergies works very differently, but it's also very effective. So what it's doing is it's blocking histamine from binding to the tissues. So it's not an antihistamine, it's not suppressing histamine production, but instead it's blocking histamine from binding onto the tissues, and it's also helping to reduce pain that can be associated with the inflammation. And that's the MSM component of this formula. The other component, the grapeseed extract, it's a powerful antioxidant. And so this antioxidant has been proven to reduce histamine production. It helps stabilize the mast cells, and these mast cells are the ones that will release the histamine, so it helps to stabilize so you won't get these histamine releases, and finally also helps to decrease inflammation. 2 tablets or 2 capsules twice a day with food is the dosing for that. From the biological medicine perspective, we've talked about working symptomatically, but then also working at the gut and with the flora, the microflora, and gut and immune system. So I've reviewed the remedies that work more symptomatically, but also do help to do some drainage and detox. But then let's talk about some probiotics as well. So probiotic 7-in-1. This is our #1 probiotic, and it has 7 different strains, different lactobacillus, lactococcus, bifidobacterium, and streptococcus. And so really great because it is helping to colonize throughout the ileum and the large colon. The other thing that's really nice about this probiotic is that it is resistant to oxygen, gastric acid, and bile salts, so therefore the probiotic gets to where it needs to go to colonize. And it's also heat stable, and that's just in the manufacturing process that happens. And so with heat stable, that means it doesn't actually have to be kept in the refrigerator. Some patients and some people do keep it in the refrigerator because that's what they're used to. However, with this one, we have studies showing that the probiotics are viable for 2 years outside of the fridge. And so this means that for patients that have an out of sight, out of mind mentality, then they can keep their probiotic front and center on a shelf. It's also one that they can take traveling with them as well. And so 1 to 2 capsules twice a day is a recommended dose for this. We also have another probiotic, Lactobacillus sporogenes. It's a little bit different. This is a single ingredient probiotic. It does include some FOS as well as a prebiotic. And This one is used again for intestinal flora, but it's also excellent for diarrhea or after diarrhea and after antibiotics or diarrhea caused from antibiotics. So it's one that is really important to be using for patients that have been on antibiotics to help recolonize this species. The other thing that's great about this product is it's shelf stable, and it goes through the spore form through the stomach, so therefore it gets into the duodenum and then it germinates and then it multiplies. It's also a right spinning molecule or microorganism, and so the right spinning means anything in the body that kind of is in a healthy way is right spinning. And so therefore it's very compatible with the body in that way, and it produces lactic acid, but the good kind of lactic acid, and so it also actually helps to alkalize the body or normalize pH. I know a number of practitioners, even some specifically in Calgary, that instead of alkalizing with an alkalizer, use this Lactobacillus sporogenes as an alkalizer and have great effects with it. And it's also appropriate to combine probiotics up together. So if you've got patients with severe gut issues, or you really want to colonize with a lot of probiotics, then you could have patients initially taking probiotic 7-in-1 and also the Lactobacillus sporogenes. One of the pieces of advice that I use is I never recommend to take the same probiotic for the rest of your life, day in and day out. It's really important to use different strains of probiotics and use them and then rotate onto another one and rotate onto another one. We have over 400 different species of microflora in the gut, and so just by taking one species, you're not necessarily going to help the entire population. So it's always good to be changing things up, and having multi-strain probiotics definitely helps with that. We had one question come through about how do these work in combination or in comparison with human microflora. Because they're different species, they just work differently. All the different species have their different roles within the body and affect different things. And so I would encourage, because there are some really good human microflora probiotics out there, to also use those with your patients as well, and just rotate through the different species. Just back to lactobacillus, 1 to 2 capsules 3 times a day. And if you're working from an antibiotic perspective, then you can just do it for a short time, 10 days, or and then take 1 capsule daily until the bottle is finished. And then the last thing I want to talk about before we talk about an allergy protocol is the right C. And the right C is a vitamin C. It's a sodium ascorbate form of vitamin C, and it's been patented in such a way that it gets the ascorbate into the blood very quickly and then keeps the plasma levels up for quite some time. So it's a very effective vitamin C. It also has this riboperin, which is a black pepper extract, which increases availability, bioavailability, and absorption as well. Now, why I mentioned vitamin C is vitamin C works like a natural antihistamine. In allergies, vitamin C works by destroying the molecular structure of histamine, thereby decreasing the amount of histamine in the blood. It also works to reduce inflammation, and because this one is an alkalizing, a slightly alkalizing one, then you're also helping to just calm down the allergic reaction in general. So vitamin C, it's great for the immune system in amongst all the other things that it does, but specifically with allergies, it's a very good thing to consider. The other thing that's really great with this, the right C, it's a powder form. It's got a neutral taste, so it can be mixed with water or it can be mixed with juice. You can get up to high levels quickly if you want. So half a teaspoon is 2.5 grams. So if you want patients to be taking up to bowel tolerance, which in some cases is 10 grams or higher, they don't necessarily have to take a huge amount to get there. So they could be taking 2 teaspoons a day, and that would get them up to 10 grams. And some patients can tolerate even more than that. So if you want to get their vitamin C levels up very quickly, then this is a really good one to do that. And then finally, I just want to review an allergy protocol, trying to put this all together. So if you're dealing with acute allergy symptoms, very acute allergy symptoms, then Allernest would be the one that I would recommend first with Alcatab. And so with Allernest, 10 drops in water every 15 minutes until symptoms resolve, and then move to 20 drops in water 3 times a day. I would also recommend, at least for the first 10 days, to do Alcatab, 1 tablet 3 times a day as well. And so if it's general allergy symptoms, so inhalant allergies, or during allergy season, then this is a good option to continue until symptoms improve. So 2 options, either Allernest or Allergies. So Allernest, 20 drops in water 3 to 5 times a day, or Allergies, 2 caps with food twice a day. Some patients manage better with certain things than other things. Allernest, though, would be the first thing I always reach for when I'm dealing with allergies. Also, with the allergy symptoms and during allergy season and working on the gut, I would always recommend a probiotic, in this case probiotic 7-in-1, 1 capsule twice a day, and then alkalizing to get the acid-base balance better back in balance, because an acidic body is a reactive body, which also means it can be an allergic body. So basic powder or basic tab. If you're using the tabs, then it's 2 tablets. If you're using the powder, then it's 1 teaspoon in warm water on an empty stomach twice a day. Okay, and with that, we are at the end of the allergy, airway, and sinus congestion webinar. What I would like to do is thank you very much for listening tonight to the allergy, airway, and sinus congestion webinar. As always, it's a pleasure to be able to present and share the information that I have accumulated over years of practice and studying and mentors. And so, once again, thank you very much for attending, and have a really lovely evening. Take care. Bye-bye.